Abortion. Abortion is the removal of pregnancy tissue products of conception, or the fetus and placenta, from the uterus. In general, the terms fetus and placenta are used after 8 weeks of pregnancy. Other terms for an abortion induced abortion, termination of pregnancy, and therapeutic abortion. Sign of abortion. It is possible to experience a miscarriage without bleeding or spotting. Other signs that a person may be experiencing a miscarriage include clumps, pain, loss of pregnancy symptoms, and passing discharge, which may be springy and or whitish pink in color.
Symptoms of a miscarriage. The main sign of a miscarriage is vaginal bleeding, which may be followed by cramping and pain in your lower abdomen. If you have vaginal bleeding, contact a GP or your midwife. Most GPs can refer you to an early pregnancy unit at your local hospital straight away if necessary. You may be referred to a maternity ward if your pregnancy is at a later stage, but bear in mind that light vaginal bleeding is relatively common during the first trimester or first 3 months of pregnancy and does not necessarily mean you're having a miscarriage. Next is a causes of miscarriage. There are potentially many reasons why miscarriage may happen, although the cause is not usually identified. The majority are not caused by anything you have done. It's thought most miscarriages are caused by abnormal chromosomes in the baby. Chromosomes are genetic building blocks that guide the development of a baby. If a baby has too many or not enough chromosomes, it will not develop properly. In most cases, a miscarriage is one-off event and most people go on to have a successful pregnancy in the future.
Preventing a miscarriage. But there are some things you can do to reduce the risk of a miscarriage. Avoid smoking, drinking alcohol, and using drugs while pregnant. Be a healthy weight before getting pregnant. Eating a healthy diet and reducing your risk of infection can also help.
After a miscarriage or abortion can be an emotionally and physically draining experience. You may have feelings of guilt, shock, and anger. Advice and support are available at this time from hospital counseling services and charity groups. It is important to remember that most miscarriages are one-off and are followed by a healthy pregnancy. First trimester miscarriages are often caused by problems with the chromosomes of the fetus. Chromosomes problems. Chromosomes are blocks of DNA. They contain a detailed set of instructions that control a wide range of factors, from how the cells of the body develop to what color eyes a baby will have. Next is placenta problems. Is the organ linking your blood supply to your babies. If there's a problem with the development of the placenta, it can also lead to a miscarriage.
Second trimester miscarriages. Long-term health conditions. Several long-term health conditions can increase your risk of having miscarriage in the second trimester, especially if they are not interested or well controlled. These include diabetes, severe high blood pressure, lupus, kidney disease, an overactive thyroid gland, an underthyroid gland, antiphospholipid syndrome. Food poisoning can caused by eating contaminated food can also increase the risk of miscarriage. Listeriosis, most commonly found in anthropomorphized dairy products such as blue cheese. Toxoplasmosis, which can be caused by eating raw or undercooked infected meat. Salmonella, most often caused by eating raw or party-cooked eggs. I see a phrase that a woman who seeks or requires abortion-related services is entitled to be provided with such services by midwives. By the woman and respond appropriately, the education of midwives should prepare them for their role in providing abortion-related services that ensure safety. We, as a future midwife, we are responsible to the health of a mother and a baby. We provide extra care to ensure the safety. I learn to care, I care to learn.